How would you feel if you have spent most or more than half of your life dealing with chronic pain? Being in your early 20s and developing post traumatic migraines for 12 years, so from your beginning onset of your double digits, dealing with things like Epstein-Barr virus complications, arthritis, Crohn's disease, Berger's disease, cranial cervical instability, and so many other things at a very, very ripe age. Today, we have another chronic pain conqueror who has not only been dealing with chronic pain since the onset of being a young age in her teenage years, but is going through college and still being amazing in everything that we do. Today, we are blessed to have Claire Lapat on our show. Are you ready for another chronic pain conversations? Let's go. Hello, and welcome to another Chronic Pain Conversations. My name is Kalila Bruswell, the Overcomer, and this is my lovely co-host, Sharifa McLaren Thompson. How are you doing today, Rifa?
I'm doing good. I can't even lie. I'm having a good day.
How are you?
I am.
I'm glad to hear it. She is smiling from ear to ear from the time we've been in backstage. See that, ladies and gentlemen? That's been there from the time that. That's why I love her. That's why I love her. Because she's just like, she brings me up. We're going to start our show off the way that we always do, Rifa. We're here and we're always talking about acknowledging the wide varieties of chronic pain, the diagnosis, and looking at ways to manage it. But we're going to get into the part that you love the most. We're going to talk about pain and pleasure. Are you ready, my love?
I am ready.
Tell me, pain or pleasure?
I am right now pleasure.
Okay.
So, this is actually going to be really funny. I'm pleasure because I smell my mom steaming some fish downstairs. So my belly is about to be all pleasure after the show, and my nose right now is just seeping in, all the smell, and it's illuminating my senses, and that just has me like, if I could show you a happy dance right now, it would probably be like soca music or reggae, and my waistline just non-stop moving. So I'm definitely all pleasure.
I'm not gonna lie to you guys. If you are in a West Indian household, you would know right now when I say she's a bottomless pit. She have empty belly,
like belly is well long right now.
It's well long belly.
But can I share something real quick?
No.
Because anyways, so at the beginning of the show, remember we told them that I got transplant and they couldn't see my white thing. So I'm wearing a top where you can actually see the scar.
Yeah.
Where it was. So I am actually not doing dialysis anymore, and that's the proof.
Can we just give her a? Because from the day that I have known this chick, she's always had something.
That's all Taylor's seen with. Yup.
Oh my gosh.
But how are you feeling? What's going on with you? Pain or pleasure today?
Do you want the truth, or do you want me to?
We always want the truth. We only tell the truth on this show. So
I am in pain today, my love. I'm actually going to try and not break down right now. I meet with a psychiatrist every 2 weeks or so because of the fact that I have chronic pain and, depression and all the things that we battle with, and we need to talk to people, which is why I'm such a big, huge advocate.
Absolutely.
And I haven't even, for the audience members, they don't even know this, that I haven't really even talked to Rifa about this. I haven't really talked to my family, but my cousin committed suicide two weeks ago. And so I had the opportunity for the first time since it happened to actually have a conversation with a clinician about it, because having those feelings, having those emotions, having functional seizures, which get set off by emotions and, your psychological aspect of it, I go into pain. So I can't mourn my cousin. If I choose to mourn my cousin, my body will go into a flare up.
Absolutely.
And so my heart hurts today and it affects my body a little bit. And I'm such a big advocate when I talk to everybody about understanding how your emotions play. Like we always talk about chronic pain, but I really talk to my clients and I talk to people and even on here, how your emotions can affect what is happening with your chronic pain.
Yeah.
And it boggles my mind that if I'm in this position, how many other people might be faced in this position and not be educated in understanding that grief can be hurting their body as well. And it's a very hard thing because I'm allowed to feel grief. I should be allowed to feel grief right now.
Mm-hmm.
But if I feel grief, my body will give me a very big middle finger in the air and say, I'm taking over.
Yeah. And I can definitely relate to you 100% in those aspects. I lost my dad, of course, and it was the same thing for me. I knew that if I really grieved and took it to heart, that my body would flare up. That would cause me a lupus flare, which would then affect my kidneys. Having just gotten a transplant, I can't afford that. So I had to do counseling as well and, find different ways to manage. But I do cry from time to time. It's okay to cry, but it's one thing. It's important to have that person that you speak to.
I envy you that you can cry. Because if I cry,
it brings you just to that place, period.
I might not be able to walk.
Yeah.
It'll debilitate me. And so I think it was so funny. Like I came on and I didn't even get the opportunity to, but with this going on, I really want to have a show on this in terms of, like we've talked about depression, which is one thing, but I think that grieving or more so the emotional, psychological aspect of it, because you're allowed to feel feelings. We're human. That's part of who we are.
Yeah.
And all of a sudden we have this condition that's like, oh, you want to feel pain? When your mom comes and she's like, you want to cry? I'll give you something to cry for. And now that's
I can't even tell you how much times I heard that. Like, stop it balling. We'll give you something for balls. I'm like, okay.
And that's what my body is saying to me.
Yeah, I totally get it. And I agree with us doing a show in future on grief because losing a loved one is chronic pain. That pain will forever be there, especially when you have that bond. That it's long term. So look out for a show on grief, guys. Come into a chronic pain conversation near you.
So I'm just telling all of our audience members, because we've said it before and we'll say it again. If you see me twitch today, don't ask questions. It's just a functional seizure.
Yeah,
I will still function in the middle of the seizure.
You will. She will.
I will tell you one thing. What is so important about having your family and your friends and community to build you up is having people like Sharifa in my life, because outside of the pain and pleasure moment, she had me laughing all the way up to the point where we were saying record, and she'll until the point that we say end. So my heart might be in a bit of pain, but I am always in pleasure to even be able to advocate or have these conversations so openly for our chronic pain community. So let's get out of this segment and take us into the segment that I am so...
Let's just get straight into it.
Rifa, we have had two, this is going to be our second guest now, guest who has dealt with chronic pain. And you guys, we didn't even plan this. We were picking who we want to come in, but we didn't realize that we were going to have back-to-back guests who are dealing with chronic pain from the beginning of their single digits. When we talk about children in chronic pain, we need to be very aware of what is going on. And they don't need to be stuck up in a hospital. They don't need to be in a wheelchair for you to understand that they're in chronic pain. And so
It's true.
we're talking about Crohn's and colitis, which is a topic that you love. That
Well, I
advocate for.
personally, I don't know much about it, but my sister's been diagnosed with it. So I felt like it could have been a really good thing for even me to gain knowledge on.
Okay.
And there's other people who are going through it, and
Yep.
we got to reach some people. So, Kalila, did you know that Crohn's disease and ulcerative colitis are both inflammatory diseases of the digestive tract, but they are different? They affect different parts of the system.
So we're talking about, hold on. So, okay, I didn't know that.
Okay.
So I'm someone with IBS, GERD, and hiatal hernia. But Crohn's disease is now another aspect of your gastrointestinal.
Right. So,
Shut up.
So Crohn's disease can affect any part of the gastrointestinal tract, from the mouth to the anus. So keep that in mind.
And that's a long tract.
Right.
Don't forget that our stomach and our intestines don't go straight down. There's like a whole bunch of.
It's like a water slide. Yes.
Right.
Ulcerative colitis, and I hope I'm saying that right, only affects the lining of the colon, which is the large intestine.
Right.
And it's usually starting at the rectum and moving up. Sometimes it affects the entire colon. And the colon is a very detrimental part to your gastrointestinal area too.
So one's coming from the top and one's coming from the bottom?
Absolutely.
And this is why we always tell you go get your colon cancer and your check and your everything else like that.
Right.
Wow. Okay. Well, our guest is going to explain so much more about this today, aren't they?
So our guest today deals with Crohn's disease, but not only Crohn's disease. She battles endometriosis, Berger's disease, all that stuff Kalila said at the beginning. I'm not even going to try to call those names because those are going to be some bloopers right there. But even just the thought that she's been brushed aside in regards to her ailments bothers me. That's one of the many things she had to endure while being on this chronic pain journey. So at this point, I just want to hear from the main girl herself, Claire Lapat. Are you ready to bring her on?
Let's bring her on. Let's have this conversation.
Let's do it.
Okay.
Hi, Claire.
Hi.
How are you doing today, my love?
I'm all right.
Awesome. Wow. Welcome to the show. We're so happy to have you here.
Yeah, thank you so much.
Okay.
Go on, Sharifa.
All right. I'm excited, guys. I don't know if you can tell, but I'm excited. So, Claire, do us a favor and identify the chronic pain conditions. Like, help us understand with like medical definitions if you can, and just share with us your journey, how it started, how it all began.
Yeah. So it started probably with brain injuries, starting when I was 10. I was a soccer player and I kept hitting my head over and over and over. I started heading the ball when I was 3 years old. That's now been banned in the US. You're not allowed to start heading until you're 10, and then it's regulated up until 14, which is better than nothing. I still can't say that I really like having kids head the ball at 14, but so I started heading the ball when I was 3. I eventually had to give up soccer and all contact sports by age 16. I ended up missing a year of high school, deferring, transferring, and I became a cross-country runner. But around the time I started high school, I started having a lot of abdominal pain, and I'd had a history of broken bones in the past, like a lot of broken bones. And with the pain and then the bones, and then I broke my hip my sophomore year of high school. And it was an avulsion fracture. So the IT band and the hip flexor kind of ripped apart the bone. And I had a bunch of blood tests done because it was a weird fracture for a non-contact sport, because I was running track. And I had a bunch of the blood tests done, and it showed a lot of nutritional deficiencies. And I had some abdominal pain, but nothing that was super concerning. We kind of attributed it to the brain injury, since that can cause abdominal pain and nausea from different, like, sort of vagus nerve dysfunction, stuff like that. But my orthopedist kept asking if I had an eating disorder, and I said no, but he referred me to an eating disorder clinic anyways, which I never went to because I knew that wasn't the issue. And, you know, and then eventually we just kind of forgot about it. And then I missed the year of school. I transferred. I was in cross country. And then I went to university at the University of Pittsburgh. And within the first month of school, I got really sick. And I had 3 organs shut down: my liver, my kidneys, and my pancreas. And eventually it came back. I got, like, the function came back. But then I got mono, which is caused by Epstein-Barr virus. And that took a lot out of me. And then I had my appendix rupture during finals week, the first semester of freshman year. However, when I went to the ER, because, you know, student health had sent me, because I went in just for a Zofran script because I thought, oh, maybe I'm just nervous. They told me that I just had period cramps, and they sent me home, but not without a script for Oxy. By the end of the week, I had a really high fever. I was septic, and I was trying to take my finals, which didn't go well. I eventually went home, had surgery, and just in the nick of time. But that was really scary. And then I got pneumonia as soon as I got back to school in the spring. And in between all of that, I kept having episodes of anaphylaxis. And that was also really scary, and we didn't really know why, because I have no IgE allergies. So nothing ever came back positive on a blood test. And eventually, you know, sophomore year, it was like the same thing. COVID hit, we got sent home. And at this point, I was doing really poorly. I was really sick. I couldn't really eat anything. I was losing massive amounts of weight. And yeah, I was sick all the time. And I saw an immunologist who I usually see regularly for the anaphylactic episodes. And she referred me to a GI. Now, I'd been referred to a GI before while in high school, because they'd seen inflammation on an MRI of my hip. They'd seen it in the visualized part of the colon. So I go see this GI in high school, and all he does is, like, shove a popsicle stick up there and goes, well, you're too young for a colonoscopy, so here's some Colace. And I was like, well, I don't want to go through a colonoscopy, so sounds good to me. So when I had to go see a new GI in college, I was terrified, because I thought all it was going to be was another popsicle stick shoved up there. And that was an experience I never wanted to go through again. And this GI was amazing. And he got me in for a colonoscopy and endoscopy. And I didn't really expect it to show anything, but I was wrong. And he had told me afterwards that they'd seen ulceration. There was narrowing of both the colon and the upper part of the small intestine, the duodenum. and that he wanted to do a few more tests. And they'd also taken biopsies. He called me a few days later. The biopsies showed a lot of inflammation and were consistent with Crohn's disease. But he still wanted to get this capsule endoscopy study done to see how extensive the disease was. And I'm so grateful we did it, because the second part of the small intestine, the jejunum, which is really important for nutrient absorption, but is not able to be seen on scopes, was severely affected. And I got a call from him like a few days after that capsule endoscopy, and he got me in right away, and I started on Crohn's medications. And
I have 2 questions for you, Claire. Number one, you have all these adults. So you're this youth. And, at that age, you're expecting to, because you're still trying to figure out life and just even get used to it, you're relying on all these adults to help you. And you have had so many people either misdiagnose you or not want to diagnose you because of your age, or overlook certain things because it was just like, well, you couldn't possibly fit into this bracket because they weren't knowledgeable to extend their parameters. What were your feelings? What were your thoughts? How were you dealing with this in terms of, we've used words like anger or anxious or, depressed, because these are things that were going on. How were you feeling? So that's question number one. And question number two is can you tell our audience what it is that you have attached to your face and what it is for, so that people have an understanding? Because it's not the first time that we've been out there and we've seen somebody, but help us to understand what it is that you go through.
Yeah. So in terms of how I was feeling, like kind of just being brushed aside or dismissed, I definitely became a very anxious person. I was kind of an anxious person before that, just because I am very type A. But this was a different kind of anxiety, because I so desperately wanted someone to believe me, but I was a little girl with a little voice. And and especially in GI world and orthopedics world, that they're all men pretty much who are doing this. And so, like, for me, I was being hysterical. I wasn't, in as much pain as I said I was in. And eventually, I wouldn't have been able to stay strong, I guess, without the support of my family. Because my mom, especially when I was younger, she did help advocate for me. Although I did start kicking her out of my appointments at a really young age, because I did want to have like one-on-one talks with my doctors. But I think that I was a little bit too, I think I was stubborn almost. I was like, no, you're going to find an answer. And I didn't quit. Maybe I should have, but I'm glad I didn't. And in terms of this is a duo tube, which I had placed a few weeks ago. This is actually the second one I've had this month. And I was hospitalized for 2 weeks at the beginning of the month because I wasn't able to tolerate anything orally. And I had a CT scan done. They found a new stricture, which is like a narrowing of the intestine. And they actually found 2 new strictures, and one in the colon and one in the duodenum. So totally opposite ends, but it was causing some obstruction issues. And so I have this to help me get nutrition because I'm having nutrient absorption issues, and stuff like that.
So my first question with that, is that too permanent? And with that, okay, so it's not permanent.
No.
Okay. So with that, can you describe like what a typical day looks like? I know you have support of your mom. Do you have any other support throughout the day? What is a typical day or even week look like when it comes to what you deal with or all that stuff? So let me know.
Yeah. So I'm in school, so I'm away from home. So I have my roommate, and she's amazing and has, been a huge like support for me. I have a lot of good friends who I can lean on to, who, they don't understand fully what I go through every day because there's no way for them to. But just the fact that they believe me and validate how I feel is really, really important. But on a day, I try to keep my wake up and bedtime consistent. I wake up at 7:30, I take my meds, I, hook up the feeds, whatever, at this point, since I don't really eat much by mouth. And then I go to class. So my class schedule does look different every day. So and yeah, it's a lot of class, a lot of studying. I do try to make time for like fun and rest and stuff like that. But yeah.
Question for you. One, what does your clinical team look like? Because when she was asking about treatments. And two, does your college provide any support knowing that you have these ailments? I don't even know if you've applied as a student with disability, but is your college aware? Do they support you? And what does your clinical team look like?
Yeah, so the clinical team, I have my primary care, who's awesome. I have my GI. Actually, have a few GIs because, of course, GIs do different, like they have their subspecialties. So I have a general GI at home, like in the Philadelphia area. And then I have my IBD GI, and then I have a motility GI. Because of course they don't do the same things, which is really complicated and annoying because it's so interconnected, yet they kind of are like, well, this goes outside my specialty. And I'm like, okay, good. I have a nephrologist. I have a rheumatologist at home and then at school. I have immunologists at home and at school. Those are like the main players on the team.
Okay.
And then in terms of school, so I originally applied for accommodations because of the brain injuries. So I got those like right off the bat coming into college. But as more and more things have come up, I've been able to like just kind of manage the accommodations and change the accommodations as needed. And a lot of times, like my professor, like I always talk to my professors about kind of making them aware that I have autoimmune issues and had a history of traumatic brain injury at the beginning of the semester. And then when things do happen, like I'm hospitalized, they kind of, because I've talked to them, I guess that it's in the back of their minds that it could happen. Like if they see the email history from me, and they have been so accommodating for the most part. All my professors this year have been great. I've had professors in the past who have not been great with accommodations, like with taking my final with appendicitis, but because it was that or get a 0. So I tried to take it. And, but yeah, at this point, my professors are all so great. with accommodating me more so than like a school administration, because there's only so much the administration can do and like the disability resources, because it has to be like generalized. But when it's like with the professors, they can kind of work with you to make the class work.
That's awesome.
That's awesome.
Yeah.
Claire, I'm going to go into the quote that you gave us. It says, I believe, and there are others out there who believe you. Your pain is real, and you know your body best. Keep fighting and advocating for yourself. You are not alone, and there are people out there who you can connect with. You just have to find them. This is something that me and Kalila always say, not in those exact words, but always tell our audience. Why do you personally say these words and live by them?
It always pissed me off when doctors would be like, well, I've been doing this for 22 years. I'm like, yeah, and I've been living in my body for 22 years. So I think I'm a specialist. Because when it comes down to it, like our intuition, we know when something's wrong, because it's our bodies. We know what they're supposed to feel like. Everyone's body kind of feels different, you know. Like I can't know how your body feels exactly, and, you know, or the next person's. I only know about mine. And so the doctor, if they're trying to tell me, well, these tests came back normal, I'm like, yeah, but it's not normal to have this, this, and this. So I know that there's a problem, and it's your job to find it. And I think that just having people who believed me was so important, and was the only reason why I was able to keep searching and digging for answers that I knew I deserved, just as everyone deserves to have answers for why they feel, if they feel horrible. You know, it, like, pain is it.
I have a question for you, because your tenacity, your determination, your voice, your power, even at the fact that you were saying, I might be a teenager, but my mom's not coming into this room. We're having a conversation about what's going on with me. And even now with you doing the whole, I know my body, I'm a specialist about me. Where did that come from? How did it get instilled in you? Where did that mindset come from? Because we have so many chronic pain conquerors that don't know how to be as powerful as you. Can you just tell us how you developed to be this person?
I have no idea. I just don't have a filter. So I just start talking and then think about it later. So then sometimes I'm like, I walk out of an appointment, I'm like, I was a little rude. But then
you know what? My friends back home call me just so, just for that same reason. Whatever needs to come out, comes out just so. So, wow. This has been, you know, we have different people that come on, and I think the more and more me and Sharif has done this, like we really shifted season 3 to bring people on to hear their stories instead of us just trying to explain it, what the conditions are. And even though every week we do not get to, you know, get fully in depth to what every, like you said a word up here, duodenum. I don't know how to pronounce it. I don't know how to say it. But the fact that you are living your life, fighting for your life, willing to be that chronic pain conqueror that's talking about their life on Instagram, that you're showing the ups and the downs when you're in the hospital, when you're like, you know what I mean? Like there's people that would shy away and be like, I'm not being seen like this. And you are in front of us, you know, and willing to say, I'm going to be who I am, love myself, grow through it. Still, like, girl, the fact that your teacher was like, you know, fail. I don't care if you're dealing with your pain, fail or do the test, and you still showed up with your appendix inflamed and you did it. I commend you. I commend you. And I
applaud you.
I applaud you.
Being away at school, away. She's not home. She's away.
wherever it is that God leads you, whatever it is that you choose to put your hand on, wherever it is that you choose to go, whether we talk again or not, I pray that you break down walls in ways that other people have been struggling in, because you have such a fighter spirit in you. I commend you for who you are. I am like in awe of you right now. I'm just,
I second that.
and you're half my age, and you're half my age. I commend you and I applaud you, my love.
Thank you.
I couldn't have said it any better. I'm speechless, because the fact that you're still pushing, you're in this no care frame of mind where I'm gonna do things to accomplish and keep fighting and doing what I need to do for my life. I can't say it better myself. I'm very proud of you. Very proud of you, absolutely.
And she hasn't even gotten the family yet, or the job yet, or the getting into the 30s and trying to figure life out and screw everybody else. And she's already like this. So
it can only get better from here.
Do it, honey.
But Claire, please let us know where our viewers can find you. Instagram, email, what is available for anyone to reach out to you?
Yeah, my Instagram is definitely the easiest way to reach out to me. It's where I'm most responsive in the handle, or my handle is in my name right there, at chronicpains.chronicgains. And I try to talk about not only my journey, but common issues that people who do suffer with chronic pain may experience, especially women.
Awesome. Claire, we thank you so much for joining us today. We're going to ask you to hang on backstage as we include a close up. But we thank you. Our chronic pain community thanks you from the bottom of my heart to joining us today to share your journey with each and every person that's viewing.
Yeah, thank you guys so much.
No problem.
All right, we'll see you soon.
Okay.
Sharifa.
Don't call me like that.
I mean, my heart was hurting for personal reasons. And last week's show left me speechless. But then I watched, I commend these conquerors. I mean, like, I've gone through my life, and if anybody has followed me, they know that the reason why they call me the overcomer is, you name it, I've been through it.
Right.
And even though I've dealt with physical, emotional, sexual, and all those different kinds of abuse, living with chronic pain every day is a whole new battle.
Absolutely.
And this has only been part of my life for 4 years. And we've got someone like Claire who's been dealing with this in more than half her life. And I know that she has to deal with it for the rest of her life.
Yep.
But she has learned how to manage it. And I just want to say to any audience member that's watching this, you know, it's not to compare.
Yeah.
I hope that she gives you hope. I really do hope that she gives you hope to know that you can still find happiness. You can still obtain your dreams. You can still get your education. You can still ... whatever it is that you want.
I definitely agree with you. And even what touched me was the fact that one of your professors didn't have empathy. Your appendix ruptured and there was no empathy. And I feel like that's not something that is not known by anyone. That's a common thing to happen, but yet still it was either get a 0 or come write your test. I personally want to ask all of us, chronic pain journey, going through it or not, let's have empathy for one another. We don't know what each other's going through. It may be easier for me than it is for you, but let's just still keep that mindset of empathy, because people are going through some real stuff out here. It's not just a hearsay, it's being experienced. So that's my thought. But like we've been saying, we applaud Claire for everything that she has done, is doing, and believe it or not, she's going to continue to do.
Doing. She is going to be one of those. She's just going to be one of those. She's a trailblazer.
Absolutely.
She's a trailblazer.
Absolutely.
And with
I'm
that,
going to go into our keep it moving moment.
that's exactly where I was going, my love. That's exactly where I was going. Go ahead.
Okay. So our keep it moving moment is, I hope you live a life that you're proud of. And if you find that you're not, I hope you have the courage to start all over again. I'm going to say it one more time because I really like that one. I hope you live a life that you're proud of. And if not, I hope you have the courage to start all over again. And that is from F. Scott Fitzgerald.
We pick our keep it moving moment before the show starts.
Before we prepare for the show, yeah. But it clicks.
It clicks. It always goes together. Oh my gosh.
Yeah.
Okay.
Guys, that is our show for today. My name is Sharifa McLaren Thomas from YouTube's The Thomas Life.
And sorry, I'm still stuck on Claire. And my name is Kalila Brucewell, the Overcomer, you guys. We will be back next Tuesday at 12 p.m. Eastern Standard Time, 9 a.m. Pacific Time with our guest, Randy Brown, speaking about radiation and chronic pain. Randy has metastatic breast cancer, and we all know that radiation is part of a journey like this. But adding radiation to the mix of pain can be overwhelming. So we cannot wait to have her on next week. Wow.
Thanks for joining us for another episode of Chronic Pain Conversations. Be sure to follow us on Instagram, Facebook, and YouTube at CP Conversations. And if you're a chronic pain sufferer who has tips on how to manage life through chronic pain, or if you're just ready to share your story, we invite you to be our guest. So fill out our form on any of our bio links on CP Conversations.
We also invite anybody that's a business or a service that helps and supports our chronic pain community. So whether you're a clinician or physician, whether you are a chronic pain association or a support group, maybe you advocate for patients' rights. We want to invite you to be a guest on our show and promote what it is that you're doing. So you can go to our bio link and visit and fill out a promote your business form for us.
Remember, Chronic Pain Conversations is a show that enlightens and advocates about chronic pain. We hope you have